Have you ever wondered how a single cough in a crowded room can, become a citywide problem? Or what kind of magic makes a surgical tool perfectly safe for an operation? Well, the answer to both questions lies in this hidden world that's all around us, the world of infection control.
It always starts with something familiar, right? That feeling. The headache, maybe a little fever, a scratchy throat. We've all been there. You just know you're coming down with something. And that universal experience, that's actually the very first link in a much, much bigger story.
And that's really the million-dollar question. How does something that feels so personal, so much your problem, become everyone's problem? Well, it's because what feels like a sick day is actually the start of a journey, a pathway that germs use to get from one person to the next. And if you can understand this pathway, you can stop them dead in their tracks. So to stop something from spreading, you've got to understand its route. And in the world of infection control, we call that route the chain of infection. It's a really simple, but honestly, a super powerful way to visualize how germs travel from A to B.
Think of it like a 6-part relay race. First, you need the germ itself, the pathogen. It needs a place to live and multiply, which we call the reservoir. Then it needs a way out, the portal of exit. It has to have a way to travel, the mode of transmission. It needs a door to get into the next person, the portal of entry, and finally, it needs someone new to infect, the susceptible host. Here's the most important part. For an infection to actually spread, all 6 of those links have to connect, one after the other. All right, let's zoom in on one of the most important links in that chain, the mode of transmission. This is all about the nitty-gritty of how germs actually get around.
It really boils down to 2 main highways. On one hand, you've got direct transmission. This is pretty straightforward. Think a handshake or the little droplets from a cough or a sneeze. It's a straight shot from me to you. But on the other hand, there's indirect transmission. This is where the germ needs a little help. It uses the environment as a sort of middleman. And this is where things we touch every single day get involved. Germs can basically hitch a ride on stuff. We call these things vehicles. And think about it. Contaminated food, a shared water bottle, a doorknob, or, and this is a big one, your phone. All of these can act like a taxi service for germs, just carrying them along to the next person. Okay, so if infection is a chain, what's the best way to fight it? Well, the great news is you don't have to break every single link. You just have to break one. Let's dig into how that works.
This is honestly where we get our power back, because we can step in and intervene at every single one of those links. We can kill the germ itself with antiseptics, we can clean its home, we can block the exit with something as simple as a mask, or we can break that mode of transmission just by washing our hands. Every single one of these actions is a chance to snap a link in that chain.
And a lot of these interventions are things we can all do every single day. Simple hand washing is literally one of the most effective ways to break the chain. Making sure a room has good airflow, being smart about food and water safety, covering a cough. These are all incredibly powerful, practical tools in our infection-fighting toolkit.
But okay, what happens when someone is already sick? Before you can treat an infection the right way, you have to know what you're up against. And this is where the detective work really begins.
Now, the official term is etiological diagnosis. It sounds pretty technical, right? But it's really just a fancy way of saying identifying the specific culprit. It's the medical version of detective work, finding that microscopic needle in the haystack so you know exactly what's making someone ill.
And here's why that detective work is so incredibly important. Without knowing the exact germ, doctors often start with what's called empirical treatment. It's basically an educated guess, based on the usual suspects. But once they identify the specific germ, they can switch to targeted treatment. That means using the perfect medicine for that specific bug. It's way more effective, and it helps us fight the huge problem of antibiotic resistance.
So to identify the bad guy, you have to find it first. And that means taking a sample directly from where the infection is happening. That could be a swab from a sore throat, a blood draw, or a sputum sample if it's a lung infection. Getting the right sample is always the first step to getting the right answer.
Okay, so we know how to identify the enemy, but how do we keep it from showing up in the first place, especially in a place like a hospital? It turns out not all cleaning is created equal. There are actually very distinct levels of defense against germs. Everything, and I mean everything, starts with basic cleaning. This is just the physical removal of visible dirt and grime, and it's so important because you can't disinfect or sterilize a surface that's still dirty. So cleaning is always step one. It just physically gets a lot of the germs out of the way.
Disinfection is the next level up. This step uses chemicals to kill most of the dangerous germs.
and it's a huge improvement from just cleaning, but, and this is a big but, it isn't foolproof. Some of the really tough microbes, like certain bacterial spores, can actually survive disinfection.
And that brings us to the top tier, sterilization. This is the ultimate defense. We're talking about the complete and total elimination of all microbial life. It's an absolute. An item is either sterile or it is not. There's no in between. This is the gold standard for anything that's going to enter a sterile part of the body, like a surgical instrument.
So how did doctors and nurses decide which level to use? Well, it all comes down to risk. For example, a stethoscope that only touches your skin is considered non-critical, so it just needs regular disinfection. But something like an endoscope, which touches mucous membranes, is semi-critical and needs a much higher level of disinfection. And then you have a surgical scalpel. It's going inside the body, so it's critical and absolutely must be sterilized. No exception.
So how do hospitals take all these different pieces and put them all together? I mean, it's not just about a few individual actions. It's about building a whole comprehensive system that's designed to keep everybody safe.
The foundation of this entire system is something called standard precautions, and this is a really critical idea. It means you treat every single patient as if they could potentially be infectious. This creates this baseline of safety that protects both the healthcare worker and the patient all the time.
And these precautions are built on a few core pillars. You've got proper hand hygiene, using PPE, things like gloves and masks when you need them, handling needles and other sharp objects safely, consistently cleaning equipment and the environment, and of course, proper waste disposal. Altogether, they form this amazing web of safety.
In that hand hygiene piece, it's not just a vague suggestion. It's a highly structured practice. The 5 Moments Guide tells healthcare workers the exact critical times to wash their hands, like right before they touch a patient, before a sterile procedure, right after they touch a patient, and after they touch anything in the patient's surroundings. It's all about breaking that chain of infection at every single possible opportunity.
So from a simple cough to a completely sterile operating room, the principle is exactly the same. An unbroken chain leads to infection, but a broken chain means safety. So now that you can see this invisible chain of infection pretty much everywhere, on a doorknob, in a handshake, in a sneeze, how is that going to change the way you see your world?